Welcome to Focus on Health, a show on all matters health, wellness, and lifestyle. I am your host, Joy Bofenda, and on today's episode, we will be discussing HPV infection, and in particular, the one causing warts, alongside Dr. Benjamin Odongo, a gynecological oncologist, who's going to be taking us through this topic. But before we dive in, take a look at the health updates. So maybe, Doctor, you can introduce yourself.
I'm Dr. Benjamin Odongo Eli. I am a gynecological oncologist, and currently I'm serving as the chairman of the Department of Obstetrics and Gynecology at Kenyatta University School of Medicine.
Okay, so the topic of discussion is HPV low risk, especially the one which causes warts. Can you give a brief overview of what this is?
Yeah, HPV, is an abbreviation. Of course, can mean anything. So it's good to know to make the viewers know what HPV means. It means human papilloma virus, and we have got two main categories of low risk and high risk. Like you mentioned correctly, we have got low risk types that cause issues with the genital tract. To be specific, the low-risk types is like type 6 and 11, which are responsible for the genital warts. And for those who may not know what genital warts are, they are like tiny growths on the skin of the vulva mainly. And the vulva is that area that you see when you look at yourself in the mirror, and the vulva mainly consists of the external genitalia, and occasionally you may see some warty or cauliflower-like growths on the vulva, and this is usually what is responsible, which is mainly caused by the low-risk HPV types, mainly 6 and 11. It affects both men and women. Of course, I take care of women, so many times I refer to the vulva, but occasionally we also see it in men, whereby you have got penile warts as a result of infection by the HPV, human papilloma virus. I think after this we are going to dig deeper into how they are transmitted, because the main mode of transmission really for both high risk and low risk, they are considered as sexually transmitted infections, which means that one must have come into contact with someone already infected by the human papilloma virus, which is quite prevalent actually. HPV itself is quite prevalent, both in the developed world and also in emerging economies like ours. The prevalence of HPV in some parts of the world, other parts of the world like Europe, some studies have put it at 15%. But in East Africa, the prevalence is around 30%, which means that it's quite significant. It's of public and public health importance to talk about HPV.
Okay, so is it possible to have the warts around your mouth depending on your sexual practices?
Yes, we commonly don't see warts around the mouth because depending on sexual practices, we commonly don't see it. That's why they are mainly called genital warts. There's a propensity of them occurring in the genital area. But now that you've asked that, there is a concern, especially for pregnant women who have genital warts, and whether there is a risk of them transmitting the same to their unborn children. Of course, they have recorded cases of if the women give birth normally, by normally I mean vaginally, there is a little chance of the babies born through this birth canal that is infected to have laryngeal warts. We call it laryngeal papillomatosis. The larynx, of course, is the voice box. So occasionally you can have a wart in around the larynx, that is the voice box of these children. And sometimes one of the indications for abdominal delivery, or that is cesarean section, is when a woman has extensive warts. And this could be due to two reasons. One, of course, I've already mentioned about the laryngeal warts in children. But also there is, if the warts are too extensive, there is a risk of them interfering with the normal process of labor. For example, there could be a lot of bleeding as the warts kind of shed off. Or some of them are so big, they are cauliflower-like, and they kind of interfere with the second stage of labor. You don't know where to, occasionally when the birth canal is a little bit tight or small, you want to enlarge it by operative vaginal delivery means like an episiotomy. An episiotomy is sometimes very difficult to fashion or to apply when there is extensive warts. So that's why it's important for us to discuss about these issues of warts.
So also, what are the risk factors for getting HPV infection, and especially the warts?
Yeah, the risk factors, I've already mentioned that most of it is sexually transmitted. So it's a sexually transmitted infection. The issue about HPV is not really acquiring the infection, because some studies in North America have shown that even with a single sexual exposure, 90% of women will acquire the HPV infection. The issue is about clearing it. For many immunocompetent people, by immunocompetent I mean their immune status is okay, then most people should clear the human papillomavirus infection within 1 to 2 years. The problem is usually persistence, and there are factors that lead to persistence. Some of them is unknown because 10% will still persist, but any condition that predisposes to reduced immunity. By this I mean women with HIV, for example, women on treatment with chemotherapy or other immunosuppressive agents. Let's say they have a connective tissue disease and they are undergoing treatment to kind of reduce, to modulate the immunity, or even people on organ transplant, because when someone is undergoing organ transplant, you have to give them immunosuppressive drugs, and this leads to persistence of disease and manifestation of the HPV because they are not able to clear it.
So in terms of managing HPV infection, the warts, what do people do?
Yeah, the management of warts themselves, we have medical management and surgical management. By medical management, you can use immune modulators to try and stimulate your own immune system to eradicate, to fight the warts. And there are agents like imiquimod that have been used, or medical management like trying to ban them using agents that have properties that can ban, like trichloroacetic acid that can be applied. Some toxic substances that are toxic to the warts, like podophyllin, those are kind of medical management. However, you can also have surgical management, which include electrocautery. Electrocautery just means, of course, use electric current, diathermy, current to cauterize them with the electric current. Or they are too large, then you can actually resect them or excise them surgically.
Okay, so there also a risk of them coming back even after doing all these things?
Yes, because the infection is usually multifocal. You can't say that once you've resected it, you are really managed it, because the vulva is a large area. It's like a field. So, and most of the lesions that we see are multifocal, meaning they are in several areas. Even those you don't see with the naked eye, does not mean that the changes have not, the changes have not started taking place. So there is still a chance of the warts coming back. And so this calls for need to prevent reinfection with other, strains or reinfection with the warts by various means, including using barrier methods. And I may qualify this because barrier methods by barrier methods I mean use of the condoms. This may prevent acquisition of HPV by up to 70%. I say this because barrier methods are not entirely protective against warts, because some of them is just due to contact. The contact, the way it's described, labioscrotal contact between the labia of the vulva or the scrotum itself can still predispose to acquisition of the HPV and subsequent acquisition of warts and other conditions associated with HPV.
We're taking a short commercial break. Do not touch that dial. We'll be right back. But before then, take a look at the Did You Know segment. Welcome back to Focus on Health. We are continuing the conversation on HPV infection. Take a look. And also there is usually a misconception that herpes and HPV are kind of similar. Is this true?
Well, yeah, it's a major misconception. In fact, sometimes when you examine medical students, they tend to confuse the two. It's not uncommon for people to confuse herpes with HPV, but herpes causes blisters. Herpes simplex virus causes blisters. And there are two types of herpes simplex. Herpes simplex type 1, herpes simplex virus type 1, which, for purposes of remembering, it really affects above the belt. By above the belt, I mean the mouth and all that, where you see blisters at the corner of the mouth, at the corner of the lips, rather, in the mouth, mainly after a febrile episode or such a scenario. That's herpes simplex 1. Then herpes simplex 2 affects below the belt, and it is a blister-forming disease. Of course, you see blisters, but occasionally when the blisters kind of burst, then you have an ulceration. But just for viewers to know that they are different, because HPV will cause warts, especially the low-risk type will cause warts, but herpes simplex causes a blistering illness.
So a lot of people tend to remove skin tags on their own. What is the implication of doing this when it comes to warts?
Yeah, I think these are two different disease conditions. I know skin tags can be due to, some of them are congenital, means that people are born with it, or they have predisposition to develop skin tags. And some of them just tie with a string and have it fall off. But for warts, this is different. And I've already described how we manage warts, and I wouldn't really recommend the traditional ways of removing skin tags to be applied with removing warts, because even when you are cauterizing, I already mentioned about electrocautery, there's a principle of how deep you should go so that you are able to remove the wart from the root, so it does not give it, don't leave one that can grow back within a short time. And I believe that removing skin tags, the principles are different from managing the vulval warts.
Okay. So how do we screen for this infection?
Yeah, generally we don't screen for the low-risk types, because they are not really of public health concerns in terms of causing a malignancy or causing cancer. So we now really put a lot of premium on the high-risk types that cause cervical cancer. And remember, what causes cervical cancer is also responsible for what causes vaginal cancer and vulval cancer. It's not uncommon for one to have all of them pre-existing together or existing together, the low-risk types together with the high-risk type, because occasionally we've had cancers developing from warts, and you wonder how did a low-risk type develop into cancer, but they tend to coexist. There's what we call field theory, that for those who have got a cervical lesion, 10% of the time they'll have a vaginal lesion or a vulval lesion. So to answer your question, the screening now is to what is of public health importance. And our screening is in line with the WHO cervical cancer elimination strategy of 1970-90, where 90% is about primary prevention, vaccination, and all that. But the 70% is about screening with a high performance, high fidelity test that can be reproducible. And in this case, what is recommended is testing using the HPV DNA. So to answer your question, now we are moving from the traditional methods of screening, especially we used to do PAP, or in low resource or resource limited settings, we still use visual inspection with acetic acid or a visual inspection with Lugol's iodine, to now what we call about HPV DNA screening. And there are many platforms that can now do HPV DNA screening, which has already been adopted by our Ministry of Health algorithm, that ideally the first test for screening should be testing for HPV DNA. And it is quite simple to do, not the technical bit, but collecting it. It can be collected by a healthcare provider in a health institution. It's a swab collecting the vaginal fluid and subjecting it for HPV DNA. Or you can have self-collection. Self-collection, we have got self-collection kits, whereby there are projects and initiatives going on that promote self-collection, whereby the women can collect the specimen and drop it in the lab, and the results are emailed back to them. So that's about screening for HPV, and I think if we are able to adopt the HPV DNA screening, we'll be in line and on the path towards cervical cancer elimination as per the WHO's elimination strategy of 1970-90 strategy.
Okay, so you've also mentioned vaccination. Could you tell us a bit more about HPV virus vaccination?
Yeah, we've had vaccination for some time. Currently, there are 3 main types of vaccines. But before I say that, the purpose of vaccination is to enable the body to produce antibodies to counteract a HPV infection when it occurs. And that's why it's important to start vaccination early before one is exposed to the virus through means like sexual contact. So the vaccine itself does not use live virus. It uses viral-like particles which mimic the HPV capsule, so that the body can be able to produce antibodies against the HPV. And currently we have got 3 types of vaccines. We have got one that targets only type 16 and 18, which is the high-risk types, and this is commonly known as Cervarix. Then you have got one that targets 4 types, which includes 2 low-risk types and 2 high-risk types, the 6 and 11, 16 and 18, which is known as Gardasil. But you also have another one called nanovalent vaccine, which targets 9 high-risk types. And it's good to know that for our program in Kenya and many other places, what is used is the quadrivalent that targets against 4. This is also informed by our public health and studies that more than 90, actually 80% to 90% of our cervical cancer is caused by type 16 and 18. So if you are able to cover those, then you are able to cover a huge proportion of the population against the HPV and also against cervical cancer. Currently, of course, most programs are vaccinating girls because they are the ones with the cervix. And it's really a resource issue, because if resources are available, then you could vaccinate both boys and girls. And I know some countries and regions that have eliminated cervical cancer, and they have got programs that vaccinate both boys and girls. But if you are resource restricted, then you put your money where you're going to get the maximum benefit. And in that case, you target the girls with a vaccination program.
Okay, so what age should the ladies get the vaccine?
Yeah, usually we talk about up to 15 years of age. I know some programs begin as low as 9 years. But even for those who have been sexually active, you can stretch it up to 26 years. And we now know that you can go up to 45 years. So the issue now is about what level of protection do they receive when you vaccinate after being exposed to the HPV, to viruses. The younger one is, the more the antibodies generated. We call it the geometric mean titers of antibodies. At 26, of course, not so high, but there is still some protection because of the reinfection and those other factors. Even up to 45 years, but the protection gets less and less. It's also been shown that the vaccine can also help in reducing the progression from the pre-malignant to malignant conditions. You know, the cervical cancer begins with a pre-malignant phase following an infection with HPV, and this process can take up to 30 years sometimes. So maybe the vaccination and the antibodies themselves can also slow down the progress of pre-malignant phase to malignant phase.
Okay. So maybe as we finish, are there any myths and misconceptions you've had about the warts caused by HPV infection?
Yeah, well, the myth is that it's only found in promiscuous people. Because we know it's about exposure to sexual activity, but someone can only be exposed once, and then they get it. Or they could be latent, but then one gets maybe an immunosuppressive condition that I've already alluded to earlier, and then they kind of manifest just based on the fact that their immunity is suppressed. Others have been about people using contraceptive methods, that's why they are getting the warts. Those are all myths and misconceptions. You'd be surprised that people think it's about being bewitched or something like that, that for one to have such huge warts, because some of them are so grotesque when you look at them. Women can hardly walk because they are so large. Yeah, I think those are the ones. But before we finish, it's good also to mention that there are also myths and misconceptions around the vaccine. One of them is that it causes infertility, it's a sterilizing agent. But those are questions have been addressed scientifically regarding the fact that the safety profile of the HPV vaccine.
Okay. Very informative conversation we've just had, and just as Dr. Ellie Odongo has emphasized, vaccination is of importance. I have been your host, Joy Bofenda, and until next time, stay safe, stay healthy, and live with the Healthy You segment.